Dear audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 23rd lecture on pathology. Today, day 9, lecture on inflammation. On day 8 lecture, I have told you about the chronic inflammatory cells. Today, come to granuloma. Respected audience, I have told you chronic inflammation may be specific and non-specific, and a specific chronic inflammation may be chronic granulomatous specific and chronic non-granulomatous specific inflammation. Today, granuloma means granulomatous inflammation. First, come to definition of granuloma. Microscopic nodular collection of epithelioid cell is called granuloma. I repeat, we know modified macrophage is called epithelioid cell. If the epithelioid cells are seen collectively, microscopically, and if the collection looks like nodule, this microscopic nodular collection of epithelioid cell is called granuloma. By definition, if this is macrophage, it is modified to epithelioid cell, and the collection of epithelioid cell like this. If the collections of epithelioid cell in like this, seen under microscope as nodule, this nodular collection of epithelioid cell is called granuloma by definition. Now come to what are the types of granuloma or types of granulomatous inflammation. Types of granuloma or types of or classification of types of granulomatous inflammation. So types of granuloma or types of granulomatous inflammation or classification of granuloma or classification of granulomatous inflammation, all the same. Types on the basis of consistency. So on the basis of consistency, granuloma is two types. One is soft granuloma, the granuloma that contains necrosis is called soft granuloma. So granuloma containing necrosis is called soft granuloma. So example of soft granuloma in tuberculosis. You know, in tuberculosis, at the site of tuberculosis, there is caseous necrosis. So granuloma of tuberculosis containing caseous necrosis is an example of soft granuloma. So example, soft granuloma found in tuberculosis. Dear audience, the granuloma that is found in tuberculosis, it is soft granuloma, and the granuloma found in tuberculosis is called tubercle. So granuloma of tuberculosis is called tubercle. Is called tubercle. So if we want to know what is tubercle, granuloma of tuberculosis is called tubercle. Another is hard granuloma. Hard granuloma means granuloma containing no necrosis. Granuloma containing no necrosis. So examples of hard granuloma, granuloma found in sarcoidosis. So granuloma found in sarcoidosis, that granuloma is hard granuloma, there is no necrosis. And sometimes when tubercle containing no caseous necrosis, the tubercle is also an example of hard granuloma. When tubercle containing necrosis, subgranuloma. When tubercle contains no necrosis, it is hard granuloma. So based on consistency, subgranuloma and hard granuloma. Now come to based on pathogenesis. So whatever may be the type of granuloma, either subgranuloma or hard granuloma, how a granuloma is formed, what is the mechanism of formation of granuloma, this is called pathogenesis of granuloma formation. Based on pathogenesis, the granuloma may be immune granuloma, the granuloma in which the formation of granuloma immune system is involved. When immune system is involved for the formation of granuloma, that granuloma is called immune granuloma. Another is non-immune granuloma. The granuloma where formation of granuloma needs no immune system involvement, such type of granuloma is called non-immune granuloma. First come to immune granuloma. Again I repeat, in immune granuloma, immune system is involved for the formation of granuloma. So immune granuloma, it may be infective and non-infective immune granuloma. It may be infective immune granuloma, infective immune granuloma and non-infective immune granuloma. First come to infective immune granuloma. Dear audience, we know what is the difference between inflammation and infection. Inflammation caused by microorganism is called infection. So now come to examples of infective immune granuloma. It may be bacterial, infective immune granuloma. Example of it, number 1, Mycobacterium tuberculosis. You know, Mycobacterium tuberculosis causes the disease tuberculosis. It may be pulmonary tuberculosis or extrapulmonary tuberculosis. What may be the site of tuberculosis? At the site of tuberculosis, we will get granuloma. So it is an example of infective immune granuloma, bacterial type. Another is Mycobacterium leprae. It causes leprosy. At the site of leprosy, we get granuloma. Another is Treponema pallidum. Dear audience, you know Treponema pallidum causes syphilis. It causes syphilis. At the site of syphilis, we get a granuloma. And the granuloma that we get in syphilis, it is called gamma. Granuloma of tuberculosis is called tubercle, and granuloma found in syphilis is called gamma. So what is gamma? Gamma is the granuloma that is found in syphilis caused by Treponema pallidum. Another bacterial infective immune granuloma, cat scratch disease. Dear audience, you know, if cat scratches at the tip of the finger or in the hand, there will be formation of granuloma at the site of scratching or at the site of drainage lymph node. If we do histopathology of the area that has been scratched by the cat or the drainage lymph node, we can get granuloma. So this is granuloma in cat scratch disease. It is caused by gram-negative bacillus. It is caused by gram-negative bacillus. So these are the examples of bacterial infective granuloma. Now come to viral infective granuloma. Viral infective granuloma. Example of viral infective granuloma, lymphogranuloma inguinale. Example, lymphogranuloma inguinale. Then parasitic infective granuloma. Parasitic infective granuloma, example like Schistosoma. It causes disease schistosomiasis. It causes schistosomiasis. So at the site of schistosomiasis, there is formation of granuloma. It is an example of parasitic infective granuloma. Now come to fungal infective granuloma. Fungal infective granuloma. Example of fungus that causes granuloma, Rhinosporidium severi. Rhinosporidium severi is a fungus. It infects the upper respiratory tract, nose, nasal mucosa and also conjunctiva. At the site of infection, this fungus leads to a formation of granuloma and the disease is called rhinosporidiosis. The name of disease caused by this fungus is called rhinosporidiosis. Rhinosporidiosis. So, if anybody suffers from rhinosporidiosis or nasal mucosa, patient may come to you with inflammatory polyp. And if you do histopathology of that polyp after resection, we can get granuloma, and this is an example of granuloma in fungal disease. So these are the infective immune granuloma. Now come to non-infective immune granuloma. Non-infective immune granuloma. Non-infective immune granuloma, example of non-infective immune granuloma is sarcoidosis. Dear audience, you know sarcoidosis is an immunological disease. That is, immune system is involved. It is not caused by any infective agent. So this is called non-infective immune granuloma. It is also called granuloma of unknown etiology. It is also called granuloma of unknown etiology. This is all about the infective and non-infective immune granuloma. And this is all about the immune granuloma. Now come to non-immune granuloma. Non-immune granuloma. Dear audience, I repeat, I have told you about the immune granuloma. It includes infective immune granuloma and non-infective immune granuloma. Now come to non-immune granuloma. In this type of formation of granuloma, immune system is not involved. So it is called non-immune granuloma. Example, foreign body granuloma. Foreign body granuloma. Foreign body granuloma. Example of foreign body granuloma like granuloma caused by silica. Granuloma caused by silica. If anybody is exposed to silica in the tissue, at the site of exposure there is formation of granuloma, and this granuloma formation is not associated with the immune system involvement. So it is non-immune granuloma. Example, silicosis. So this is the types of granuloma, or this is the classification of granulomatous diseases. Now come to how a granuloma is formed. What is the mechanism or what is the steps of formation of granuloma? Now come to pathogenesis or mechanism of granuloma formation. How a granuloma is formed on exposure to irritant or exposure to infective agent, etc. The first and foremost step is exposure of poorly digestible irritant. First one is exposure to poorly digestible irritant like tubercle bacillus. You know, tubercle bacillus is red rod beaded bacteria. So this is tubercle bacillus. On exposure to tubercle bacillus, this tubercle bacillus is poorly digestible irritant. Second step, engulfment of bacillus by tubercle bacillus by macrophage. Dear audience, you know macrophage is one of the chronic inflammatory cell. Suppose this is the macrophage, and this macrophage engulfs the bacillus, and this bacillus is very much poorly digestible for the macrophage. Later on, what happens here? The bacteria is processed within the macrophage. Bacillus is processed within macrophage. Later on, some portion of this poorly digestible irritant, some portion of the bacillus is presented to T lymphocyte by the macrophage. Some portion of bacillus or processed bacillus is presented to T lymphocyte. You know, T lymphocyte is associated with the cell-mediated immunity. So, cell-mediated immunity by T lymphocyte is initiated. What happens if this is the T lymphocyte? The some portion of this bacillus, is presented to it. Then T lymphocyte is activated. So when some portion of bacillus is presented to lymphocyte, the T lymphocyte become activated. Activation of T cell. And when the T cell is activated, what happens? It secretes or produces interleukin 2 and gamma interferon. So when T lymphocyte is activated from the T cell, interleukin 2 or gamma interferon is synthesized or produced. This interleukin 2 activates other T cell. It activates other T cells. Suppose these are the T cells. These are the other T cells. The T cells are activated. These are activated. When these are activated, these undergo proliferation. So activation of other T lymphocytes and proliferation of T lymphocytes. Why proliferation? Proliferation is due to keep immune mechanism sustained. So to keep the immune mechanism sustained, interleukin 2 causes proliferation of the other T lymphocytes. This gamma interferon acts upon macrophage. This macrophage acts upon the macrophage, and this macrophage, due to action of gamma interferon upon it, it is converted to epithelioid cell. And many macrophages fuse together, and form multinucleated giant cell. So nodular collection of epithelioid cell, at the same formation of giant cell, there is formation of granuloma. So this is the pathogenesis of granuloma formation. Dear audience, I have told you, in tuberculosis usually we get soft granuloma. The tubercle contains necrosis. Sometimes in tuberculosis we may not get soft granuloma, but sometimes we can get in tuberculosis hard granuloma. But in sarcoidosis always we get hard granuloma. Dear audience, you know tuberculosis is caused by tubercle bacillus, but there is no causative agent for sarcoidosis. At the sites where tuberculosis occurs, in the same site sarcoidosis may occur. So tuberculosis may occur in pulmonary and extrapulmonary sites, and sarcoidosis may also occur in pulmonary and extrapulmonary site. Tuberculosis may occur in the lymph node, sarcoidosis may also occur in lymph node. Tuberculosis may occur in the lung, sarcoidosis may also occur in lung. If we get hard granuloma, we become confused whether it is tuberculosis or sarcoidosis. At that time, we need to differentiate tuberculosis from sarcoidosis. Now come to how we differentiate tuberculosis from sarcoidosis. Why you need to differentiate? Because these two diseases, one is caused by bacteria, another is not caused by bacteria, it is immunological disease. And both diseases may occur in the same organ. And in both cases, we may get hard granuloma. So we have to differentiate tuberculosis from sarcoidosis. Now come to differences between tuberculosis and sarcoidosis. Number one, cause. The cause of tuberculosis is Mycobacterium tuberculosis. Unknown. It is immunological disease. Second, granulomas. The microscopic nodular collection of epithelioid cell is called granuloma. So at the site of tuberculosis and at the site of sarcoidosis, in both cases we get granulomas, multiple granulomas. So in case of tuberculosis, the granulomas are overlapping, superimposed. So in case of tuberculosis, the granuloma is superimposed. superimposed granulomas or overlapping granulomas. But in case of sarcoidosis, the granulomas are very much separated. Very much separated. So we can separate one granuloma from another with a thin thread also in case of sarcoidosis. So separated granulomas. Number 3, caseous necrosis. Caseous necrosis, if present, it is soft granuloma. If not present, it is hard granuloma. So may be present, but in case of sarcoidosis, it is absent. Langerhans giant cell. Langerhans giant cell. You know, Langerhans giant cell, a large cell containing multiple nuclei, and multiple nuclei arranged at the periphery of this cell like horseshoe. So it is present here if this is a horseshoe giant cell. It is present in tuberculosis, but it is absent in sarcoidosis. Another, if we do sensitivity test for tuberculosis, we do Mon2 test or tuberculin test. Mon2 test or tuberculin test, it is positive and it is negative in sarcoidosis. Another is Vim test. Vim test, it is negative in tuberculosis but positive in sarcoidosis. So these are the differences between tuberculosis and sarcoidosis. Dear audience, today up to this, and I think this is the end of inflammation briefly. Thanks all.